Today we're going to be talking about selling solutions. Advocacy is a solution in and of itself, right? How do we sell a solution? So we're going to talk about that. Some of the questions that we see regularly around this topic are, how do I talk about and effectively communicate the value of advocacy to potential clients, right? Or what are the key steps in building trust and credibility as an advocate, right? How do you develop that relationship with potential clients? And then last but not least, how can I navigate, or how can we navigate challenging situations and objections during potential client interactions? So if you find yourself asking those questions, this session is for you. For those of you that may be new and wonder who I am and what's going on here, my name is Nicole Broadhurst. I'm a former healthcare administrator turned independent patient advocate, founder of The Circle, and CEO of Tennessee Health Advocates, where we help busy, committed professionals maintain work-life balance without the frustration of medical billing departments. That's what we do over there. But on Wednesdays, we're here. We're all about growing a community where we can grow our businesses, increase awareness of our profession, and maintain alignment with why we became advocates in the first place. Let's talk about selling solutions. So I gave you 3 questions to start with, right? And the first one that we want to talk about is, how do we effectively communicate the value of advocacy services to potential clients? There's a lot, okay? So you might be eager to learn how to articulate like tangible benefits of your services in a way that resonates with your prospective clients, right? I get this a lot, and it's really interesting to me. It's been this way since I niched into the billing side. And it's really easy to assume that it's easy for me to sell my services because I save people money, right? How many think that? And it's okay. It's okay. It's got to be much easier to like sell a service where you save money, right? I mean, that's just the way it is. So, right. So here's the truth about that. I only save about half of my clients' money. Anything at all. The other half of my clients, like, aren't engaging my services to save money. Okay? They're engaging my services for other reasons. And they're the same reasons that your clients are engaging you. Okay? So, how do we show and demonstrate the value of our services, right? Because they're not always tangible, right? Like, we don't sell a product that we can hold and show and they can take with them and keep on a shelf, and like there's no tangible product that we can point to the value on, right? The needle point, the stitching, the material, right? There isn't anything like that. So how do we do this? There's 3 big actionable steps that I think you can take, that I take regularly, that consistently communicate the value that I bring. So you can do this too. And the first thing that you want to do is to tell compelling stories. Right? Share real life examples that illustrate the positive impact you have on your clients. You're doing the work all the time. Okay, so share how that works. When we communicate in stories, I know this is not new, right? When we communicate in stories, we humanize the value proposition and we make it easier for clients to understand the benefits. Okay, so it doesn't have to be a tangible thing. Okay. The second thing you want to do when you want to tell compelling stories, second thing you want to do is you want to focus on the results, right? The specific outcomes and the solutions that they deliver, rather than just a menu of your services. Okay. So one of the things that I've been playing around with is do I create a menu of services? So I focus on results and I focus on outcomes. right? So we want to talk about what happens when this is all over. Part of the hard, on the financial side, part of the hard buy-in for clients is exactly what we were talking about before we got started. It takes forever. I mean, it just takes forever. There's no way around that. It's a process. It is a machine, and we are working within this machine. And because it's the financial side, I can't, like, there's no sense of real urgency. You know what I mean? Like, I can't say, my client's waiting to see a doctor because they need to be treated for X, Y, and Z. And while you're doing that, then, they're not getting seen. There's no like real sense of urgency. And so what I find is that many times I relax into the pace that the world has set, right? Like what pace is the insurance company working at right now? Because that's where I'm going to work. But pay attention and focus on the results and the outcomes. So for example, we talk about a lot of times we've talked about doing client surveys, right? And asking them these questions. How did you feel before you met me? How did you feel while we were working together? And how did you feel afterwards? And the reason that we talk about doing that is for this very reason. When we can effectively tell their story about how they were terrified to open the mailbox, right? Or they were scared to call the doctor's office or whatever that was, and tell the story about how we helped them. And then afterwards, they were able to sleep at night. They weren't afraid to call the doctor's office anymore because they knew the nurse's name and they weren't afraid to do that. Right? That transformation that we provide in that patient experience needs to be communicated through stories with a focus on the results. And if you can start crafting those stories and working them into your conversations with potential clients, I guarantee your close rate's going to go up. Okay? Because they don't have to imagine, like, how does this work? What's that going to be like? You'll be providing them with a very clear transformation process. Okay? So start with stories, focus those stories on the results. And here's the kicker. This is what's going to put it right over into your client. This is where you tailor the message for each client. Okay, you get really specific about customizing and addressing their specific needs and their pain points. All right, and you personalize that approach. Why does that matter? Because now you've given them a story that they can connect with. You've focused on the benefits and the results in that story. And now you're demonstrating to them that you see them and you hear them and that you know how to make that transformation for them too. Okay. So start with a story, focus on the results, and then tailor it for their specific need. Okay. That's how you can communicate to your potential clients and make sure that they're very clear on the value that you're bringing. Okay. Even when it's not tangible. All right, so second question that we see a lot is, what are the steps to building trust and credibility as an advocate? Right? So establishing trust is paramount in our profession, right? We're getting super intimate with our clients. We know all of their medical situations, their diagnoses, their treatments. We know many of us know their financial situation. We have access to their portals. We have, like, it's really important that our clients can trust us, right? So you might be seeking guidance on how to foster that authentic relationship with potential clients as you're bringing them in. It's super easy to cultivate trust through three things: transparency, empathy, and reliability. Okay. Those are the 3 things that will quickly allow you to cultivate trust with people who are considering engaging your services. So here are some strategies to kind of help you navigate this crucial aspect of selling your services and growing your practice. First and foremost, be transparent and authentic. Like, don't try to be something that you're not. I often share that I spent approximately 30 years of my career in a role that I was not able to be authentic and transparent. And it was why I constantly felt like I was not succeeding in that career. Numbers and outcomes were telling me that I was, but I didn't feel that way because it was out of alignment with my soul. And so make sure that you're showing up transparently and authentically. So what does that mean? Right? Those are just words. What does that mean? It means be upfront about your expertise, right? So if you're out of your comfort zone, if you're into a topic that you're not comfortable with, be honest about that, right? And talk about that with them. Be upfront with your limitations. Anything that limits your access or anything that is really important to you. If you always take Monday off because you go to soccer workshop with your kid on Mondays, and so you're never available on Monday, say so. Right? Right? Because the worst thing, and you guys know it, and I know it, the worst thing that could ever happen to us is that we buy something that we think we understand, and then all of a sudden we get it home and we don't. And it's not what we thought it was going to be. That will piss me off in 2 flat seconds, right? So we don't want to be that. We just don't want to be that. So make sure that we're upfront with our expertise, our limitations, and our processes, right? So one of the things that I sell a flat fee consult, and it takes some time to do it. And I always tell people, look, I have a 7-day turnaround time on that service. Okay, so that people understand, if you buy this service from me, you're not going to get the results tomorrow. Okay. Now, if they want the results tomorrow, and I say that, then now they have the opportunity to say, ooh, is there anything that we can do to speed that up? And then we can have a conversation around it, right? But it would be unfair for me to sell them that service without mentioning that. And then once they pay the invoice, for me to say, okay, it's going to be 7 days before I get you your report. That's cool, right? So make sure that you're building transparency and being authentic into your regular practices. So remember that this piece of this builds credibility and fosters trust. Why? Because it demonstrates. Words are just words, right? But it demonstrates that you have integrity and that you're honest. Okay, so make sure you're doing those things. That's the first thing. Second thing is tied back into our first conversation about telling stories. Make sure you have social proof to share with them. Use testimonials, use success stories, use endorsements from previous clients to reinforce your credibility and to validate your expertise. And it also reassures potential clients of your capabilities, of your skill set, right? Can you really do what you say you can do? Because other people are saying you can do what you say you can do, right? So again, to those stories. So now when you collect those stories, now you have multiple reasons to use them, multiple ways to use them. See why they're starting to be so important to gather that information so you can share it. So the third way to build trust and credibility with potential clients is to continuously educate yourself. Okay, so if you're attending a conference, if you are taking a webinar, if you are, subscribed to some RSS feed that provides you with information on your specific niche, try to work that into the conversation so that they know. I find that this happens really authentically because you're actually doing these things. And so when you're having a conversation with a potential client and they mention something, you can say, oh, I was just reading this article that was talking about that. I would love to share that with you. Okay, what does that do? One, it shows up authentically in conversation. Two, it illustrates and demonstrates that you are staying on top of your profession, right? That you are doing the work, that you're staying educated. And we all know that, especially in healthcare, the one thing that is happening every single day is change. So we may know something today, and it may change tomorrow. And so the truth is that the average consumer, the patients, they don't even have the avenues to stay up to date like we do. And even for ourselves, I can't stay up to date on everything. Like I just can't, right? I have lots of avenues, but I focus in on things that, you know, make the biggest difference in my practice. So coding changes and things like that. So make sure you're doing that, okay? And then last but not least, let's talk about these navigating challenging situations and objections during potential client interactions. So first and foremost, dealing with objections and navigating difficult conversations is inevitable as advocates. Okay? There is not an advocate out there who isn't navigating difficult conversations as part of their practice. Okay? In fact, it's one of the reasons that we have a job, is because a lot of our work requires difficult conversations. So when you get into a difficult challenge or challenging situation or an objection with a potential client interaction, just know this is part of what you do. And it's part of why you're good at what you do. All right. And just like with everything else, you can do this with grace. You can do it effectively. You can address their concerns and stay aligned with your personal mission and advocacy. And there's some really big ways to do this. So we're going to talk about 3 of them. All right. One is active listening and empathy. I cannot stress enough the significance of active listening. Okay. Actively listening and providing them with empathy, it shows that we're understanding of their concerns and their objections. So before anything else, be sure to validate their feelings and their perspectives before doing anything else. Okay? Because they're real, right? They're real and they're feeling them and it is their concern. So addressing and validating that is half the battle in overcoming the objection, right? Like just getting them to understand, I hear you, I see you, I feel for you. And this, again, super easy, right? Those of us that are coming from this with a servant heart, like that's real. Like how many of you have hear stories from potential clients and literally think you're going to cry? Like, hello, right? Yeah, because that's how we are impacted by the service that we do. So this part I expect to be super easy, right? Just, and don't be afraid to show that. Sometimes I think that we're told from a business perspective that we're not supposed to show that, but in our industry, that's bunk. That's just bunk. That's the whole reason. Quite frankly, I think that's one of the reasons that our job exists, is because nobody takes the time to empathize and actively listen to patients. If they did, less of them would need us, I think. Take the time to do that. The second thing I suggest doing is preparing responses in advance. So pay attention. I showed you my whiteboard. I always have a list of something on my whiteboard, multiple lists of something on my whiteboard. That's a small whiteboard, so I have a cork board next to it, and I have multiple lists on there too. I'm always keeping track of things. And this is one of them. What are the objections that you're getting? What do people say to you when they're not engaging your services and you know they need you? Right? You know they need you. And I'm not talking about the clients that are in the cruelly unable to afford our services. We all run across those, right? And we have a list of free resources that we share with them and we try to get them the help. We may even take a few on pro bono, right? Because that's what we do sometimes if we're able. Um, I'm talking about the ones that you're like, yeah, I really think you could pay for this, and you're just not. Like, I don't know why you're not. You definitely need me, and you definitely appear like you can afford me, and but you're not. So pay attention to those. Pay attention to those people because they will tell you why they're not. We just have to get really good at listening to what they say. So, for example, this is why I think prepare responses in advance. If you hear, ooh, that's kind of steep. Now, right? That's not, oh, I can't afford that, but it's kind of in that bucket of the same, it's too much money, right? It's too much money. But like I said, they look like they can afford you. They sound like they can afford you. You're pretty sure that they drove up in, a brand new car. They probably can make this work, but they're telling you that's too expensive and they can't. Really curious. Because what people will do when they say, oh, that's too much, is two things. One, you didn't demonstrate the value. They're not convinced. They're not convinced of the value yet, right? There might be some there, but I hear things like, oh, that's kind of steep. And when I hear that, I ask the question of, oh, well, okay, tell me more about what you would expect at that price point, right? Because what I'm hearing them say is not, I can't afford that. It's, I won't do that. I won't do that, right? So I want to find out what is it that, what would you expect at that price point? Because the truth is if they have the money and they're still saying no and they're using that as an excuse, they don't see the value. So most likely I haven't finished the job of explaining the value. So in order for me to do that, I need to start asking some questions because maybe they didn't understand something that I said. Now, sometimes when I do that, they will say to me, oh, well, I would expect a one-on-one phone call every week for that. And then I can say, oh, you do get that. That is part of this program. Maybe I didn't communicate that well. Or because we run our own business, if that's something that you can do and you're willing to throw it in, say, oh yeah, we can do that. Absolutely. Right. But be listening to them and get really curious because here's what I want to tell you. Anytime that somebody gives you an objection, and they fall into that criteria of I'm not buying that you can't afford me. You're just saying no because you're greedy and you don't want to spend the money or you're frugal or whatever that is. The truth is that's the easiest excuse in the world to give. It's like the go-to objection. I promise you that there is something underneath that. And our job then becomes, what is it? What is it? So I've even been known, so I asked the question of what would you expect at that price point? That's a good question. The other good question that I have found works really well for me is to ask them, shoot, I just lost it that really quickly. Like, anyway, the other question that I find super helpful is, what is it that makes you uncomfortable about making this investment? Because that's really what they're saying to you is I'm just not comfortable making this decision, right? They're using money as an excuse as the objection, but underneath that, there's just some level of discomfort. And so don't be afraid to ask what it is specifically. You know, what is it about this decision that makes you uncomfortable? What haven't I answered? Right? What haven't I done? You know, because the truth is that most of the time we know they need us. So we just kind of got to figure out what that is. Had clients in the past actually say to me that they just didn't feel a connection with me and that, that just wasn't working. And that's fine because it lets me know I need to just refer them out. Like, I don't need to spend any more time on this. I'm not here to go watch some of the other sales videos. I'm not here to convince anybody to work with me. That's just not how it works, right? So, prepare your responses in advance, pay attention to the objections that you're getting, and then be ready for them. Have some of these questions, like, on your desk or next to your phone or whatever that is, so that you have them accessible to yourself. All right. And then remember, objections are just opportunities for a deeper connection with the potential client. Because, like I said, there's always something underneath that objection. It's never what it looks like, it's never what it sounds like. There's something deeper. So take that opportunity to reframe your questions, ask inquisitive questions, get really curious about what they're thinking, how they're feeling, what this looks like. Okay. So those are the things that I wanted to answer for you about selling solutions, because we certainly have an amazing solution for patients. And I believe that if you take some of these actions and get comfortable with them, you're going to be amazed at how your close rate improves.